Hello everyone, and welcome back to Alpha Nutrition. Today, we're exploring the complex relationship between HIV and drug use. We'll delve into the factors that contribute to the link between HIV and drug use, discuss the impact of drug use on HIV transmission and prevention, and explore strategies for addressing this critical issue. Understanding the link between HIV and drug use. HIV, or human immunodeficiency virus, is a virus that targets the immune system, specifically the CD4 cells. When HIV infects these cells, it replicates and destroys them, weakening the immune system and making an individual more susceptible to opportunistic infections. Drug use in various forms poses significant challenges to HIV prevention and care. The link between HIV and drug use is multifaceted, influenced by social, economic, and health factors. Factors contributing to the link. Several factors contribute to the correlation between HIV and drug use. Socioeconomic factors, poverty, lack of access to education and employment, and social stigma can increase the risk of drug use and HIV exposure. Health disparities, lack of access to healthcare, substance abuse treatment, and mental health services can exacerbate the risk of HIV infection among people who use drugs. Biological factors. Drug use can affect the body's immune system, making it more vulnerable to HIV infection. Impact of drug use on HIV transmission and prevention. Drug use can significantly impact HIV transmission and prevention efforts. Increased risk of needle sharing needles, syringes, or other injection equipment during drug use can directly transmit HIV from one person to another. Increased risk of unprotected sex. Drug use can impair judgment and increase the likelihood of engaging in unprotected sex, which is a major mode of HIV transmission. Reduced access to HIV testing and treatment. Drug use can hinder access to HIV testing and treatment services, delaying diagnosis and treatment, which can increase the risk of transmitting the virus. Strategies for addressing HIV and drug use. Addressing the link between HIV and drug use requires a multi-pronged approach. Harm reduction strategies. These strategies aim to reduce the negative consequences of drug use, such as needle exchange programs, safer sex education, and access to addiction treatment. Access to HIV testing and treatment. Increased access to HIV testing and treatment services is crucial for early diagnosis, linkage to care, and effective treatment to manage HIV and reduce transmission. Addressing stigma and discrimination. Reducing stigma and discrimination associated with drug use and HIV is essential for creating a supportive environment for people to seek help and access services. Social support and community engagement. Providing social support and engaging with communities affected by drug use and HIV can promote positive changes in behaviors and access to services. The link between HIV and drug use is complex and requires a comprehensive approach to address the underlying issues and prevent transmission. By promoting harm reduction strategies, ensuring access to HIV testing and treatment, reducing stigma and discrimination, and providing social support, we can effectively address the challenges posed by drug use and HIV and improve the health of individuals and communities.